Imagine waking up one morning, feeling perfectly fine, yet inside your body, something silent and dangerous is building up. Pressure. Not emotional pressure, but real physical pressure in your arteries, pushing harder every day without you even noticing. That's high blood pressure. And it's often called the silent killer for a reason. Now let me ask you, when was the last time you checked your blood pressure? Be honest. Drop your answer in the comments, because I'm genuinely curious, how many of us men actually keep track of it before it's too late? You see, as a health expert, I meet countless men who look healthy on the outside. They hit the gym, they work long hours, they think they're invincible. But their blood pressure tells another story. High blood pressure or hypertension can quietly damage your heart, kidneys, and even your brain over time. The scary part? You might not feel a thing until one day you do. That's why today I want to help you recognize 5 warning signs of high blood pressure, signs that your body might already be sending, but you haven't connected the dots yet. I want you to listen closely, not out of fear, but out of care for yourself. Because your health determines everything: your energy, your focus, your relationships, your future. Let's start with the first sign. The first warning sign is frequent headaches, especially in the morning. Have you ever woken up with a pounding head that seems to tighten around your skull? Many men brush it off, blaming stress, dehydration, or a bad night's sleep. But recurring headaches, especially at the back of your head or temples, can be your body's way of saying, hey, the pressure inside your arteries is too high. Now, I'm not saying every headache means you have hypertension, but if you notice they're becoming more common, or they hit you right after waking, it's time to get your blood pressure checked. Don't wait for it to get worse. Prevention starts with awareness. The second warning sign is fatigue or shortness of breath. You might climb a few stairs or carry groceries and suddenly feel winded, something that never used to happen before. This isn't just about getting older or being out of shape. When your blood pressure is too high, your heart has to work overtime to push blood through your vessels. Over time, that extra effort leaves you feeling drained, tired, or even dizzy for no clear reason. I remember one patient, a 42-year-old man, who thought he was just losing stamina. He ignored the breathlessness for months. When we finally checked his blood pressure, it was dangerously high. After a few lifestyle changes and consistent monitoring, he felt like himself again. That's how powerful awareness can be. The third sign is blurry vision or seeing floaters. Have you ever noticed sudden visual disturbances like flashes or dark spots in your sight? Your eyes have some of the smallest blood vessels in your body, and when your blood pressure stays high for too long, those vessels can become strained or even damaged. Vision changes aren't just an eye problem. They can be a direct reflection of what's happening in your arteries. If your vision starts acting up, don't just assume it's screen fatigue. Get your eyes and your blood pressure checked. Because sometimes the first place high blood pressure leaves a mark isn't your heart, it's your eyes. The fourth warning sign is chest pain or a heavy feeling in your chest. Now this one can be terrifying, and it should never be ignored. High blood pressure can cause your heart's arteries to stiffen or narrow, making it harder for oxygen-rich blood to flow. That can lead to tightness, pressure, or pain, especially when you're stressed or physically active. And I'll say this clearly: chest pain is never normal. If you ever feel it, even mildly, get checked immediately. Whether it's your doctor or the emergency room, don't wait to see if it goes away. Too many men delay, thinking they're being tough. Real strength is taking care of yourself before it's too late. The fifth and final warning sign is frequent nosebleeds or a pounding sensation in your ears or chest. These are less common, but they're your body's red flags. High blood pressure can make your blood vessels fragile, and when they can't handle the pressure, small ruptures can happen, like in your nose. You might also feel or hear your heartbeat in your ears, especially at night. It's a strange, unsettling sensation, one that deserves attention, not ignorance. Now let me ask, have you experienced any of these signs lately? Even one of them could mean it's time for a checkup. You don't need to panic, but you do need to act. High blood pressure isn't just about the numbers. It's about what those numbers represent: the health of your arteries, the strength of your heart, and your overall quality of life. The good news? You can take control. Here's the empowering part. You can reverse the risk starting today. Start with small, consistent habits. Cut back on excess salt and processed foods. Choose whole, colorful meals, vegetables, lean proteins, healthy fats. Keep your body moving. Even a brisk 20-minute walk every day can make a difference. And never underestimate the power of deep sleep and stress management. I often tell men this: your blood pressure is like a mirror. It reflects how well you're balancing your life, physically, mentally, and emotionally. When that pressure rises, it's your body's way of asking for help, not punishment. Listen to it. And if you smoke, drink heavily, or live on caffeine, it's time to reevaluate. You don't have to quit everything overnight, but make progress each week. Replace one unhealthy habit with one healthier choice. Over time, those small steps will protect your heart far better than any quick fix. If you're unsure where to start, begin by buying a simple home blood pressure monitor. Check your readings at the same time each day, morning or evening, and write them down. Numbers don't lie. Watching those readings improve as you make healthier choices is incredibly motivating. And remember, if your readings are consistently high, don't be afraid to talk to your doctor. Seeking help doesn't make you weak, it makes you wise. Sometimes medication may be necessary, and that's perfectly okay. The goal isn't just to live longer, it's to live stronger. So here's my message to you. Take this as your sign. Your body is speaking to you all the time. It's up to you to listen. Don't ignore the warning signs. Check your blood pressure, stay active, and choose to live consciously. Because every time you take care of your heart, you're not just adding years to your life, you're adding life to your years. If this message hit home for you, let me know in the comments. Share your experience, your readings, or your questions. I read them all. Together, we can build a community of stronger, healthier men who take control of their health before it's too late. And if you found this helpful, don't forget to subscribe for more men's health tips, motivation, and science-backed advice that keeps you performing at your best in every part of life. Stay strong, stay smart, and take care of your heart, because you only get one.